Hello, my name's Nigel Crisp, and many years ago, at the turn of the century, I was the chief executive for the NHS here in England, which meant I was responsible for the biggest health system in the world with 1.3 million employees. Well, since then I've been in recovery, and I've spent a fair amount of that time in Africa, where amongst other things, I learned this fantastic expression: health is made at home, hospitals are for repairs. It came from a man called Francis Omaswa, who was running the Ugandan health system at about the same time as I was running the English one. And it's a great saying, isn't it? Because not only does it pay attention to all the, what people now call the social determinants of health, the things that influence your health in the community and at home and family and everything else, but it also has this notion that you can create health. And let's think about that. So starting off with, what do we mean by health? Well, health is about physical, mental, and social well-being, according to the WHO. It's about our relationships. It's about our physical feelings. It's about being all that we can be. Being flourishing is the words that I tend to use now, thinking about health. And creating health, a very interesting notion, the idea that you can create health. And who are the health creators? They're people like our parents, that great teacher we had, that wonderful school, our employers, perhaps, people who create the conditions for us to be healthy and help us to be so, help us to grow up as healthy, resilient, confident, and competent human beings. And you know, all those adjectives go together. So let me give you a few more examples of health creators, some practical examples, because I think we ignore the health creators in our society, and we need to recognize them more and bring them into partnership, not only with the health system, but also with government. Let me give you three quick examples from here in the United Kingdom. Let me start down in the southwest tip of England in Cornwall, in a small town where a policeman got fed up with chasing kids for vandalism and minor crimes and booking them, and instead started to work with them. And amazingly enough, they set up a dance club because that's what the young people wanted to do. He got some help for it and they created this club. That was 15 years ago. And over the last 15 years, something like 3,000 young people have been through that club, and they now run it. It's run by 16-year-olds as directors. And what's interesting is not only has it provided something for the young people to do, the University of Exeter has done a study for much of that period and shown how it has improved the health and physical and mental well-being of those young people, and indeed the social well-being as well. And of course, it has also reduced all those minor crimes. Who else? Well, there's a nurse who started working up in a housing estate up in the north of England, and turned into an organization called Salford Dads, spelled D-A-D-Z. And what she realized in this housing estate, which had multiple problems, was that one of the greatest assets was something that some people thought of as one of the greatest problems. And that was the large number of unemployed men around the estate. She realized how powerful that was, people of working age who could do things. And she started working with them, and over time, they have developed a lot of community activities. They've connected better with their children and their partners. And many of them have now gone on, of course, and got jobs, but making a real difference. And again, some of the indices of health and social well-being have improved over that period. Well, the final example, I'm going to go to another extreme. I'm going to go to London, and I'm going to go to some of the big financial institutions in the city. And there's been a program running now for the last 7-8 years, I think, called the City Mental Health Alliance, which is the big firms coming together, not only to provide mental health first aid, to look after people who are having problems, to provide the sort of workspaces and gyms and so on that are all about well-being, but also to change some of their business processes, because they recognized that it was the business processes and the environment that was creating some of the stress and anxiety and the mental health and indeed physical health problems that they faced. Again, they've seen improvements over this period. Now, these are just three examples of people within England who are creating health. They're not the health professionals, they're not the government. These are people who've seen something that needs doing and decided to go out and do it. And there are many, many more examples in our communities and indeed in your communities, wherever in the world you happen to be. What's interesting is I wrote a book about this called, as you imagine, Health is Made at Home, Hospitals are for Repairs. And I identified 10 features which I thought were typical of these groups. I'm not going to go through all of them, but let me just give you 3 of them. The first one is they always started by talking about relationships, by creating relationships. They didn't build systems and then look for people to come in. They built relationships. And then, of course, they needed systems and support. Secondly, there wasn't a preconceived plan. There was a vision, there was a purpose, and they set out in the direction of that purpose. But they learned by doing. They were constantly experimenting, being entrepreneurial, if you like, developing and seeing what else could happen within their community. So they were purpose-led, not plan-led, and too often in the big bureaucracies we're plan-led. And thirdly, and perhaps most important of all, they were in control. This wasn't about health professionals telling people what to do, getting involved with them, shaping them, encouraging them to do things. This was about people doing things as they wanted to do things. And in some cases, the improvements in health and well-being, of course, were byproducts of the main purpose. So what's really important, it seems to me, as we look towards the future in terms of health, is that we learn how better to work together. And by that, I mean government, which has the great responsibilities for prevention of disease, creating the conditions, protecting our health. They're the lead in that area, although we all have responsibilities. Secondly, there's the health professionals and the health system who do that fantastically valuable job of providing services, looking after us when we're ill, advising and supporting us. And what a pressure people have been under during COVID and how much we owe to them for that. But in addition to that, in the third area of health, the bit that's neglected, there are health creators, which are civil society, you and me and everybody else, who can make an enormous difference in creating health, thinking about the causes of health and not just the causes of disease. And in doing so, they embody a point that I think you embody as well, which is the health of individuals is intimately connected with the health of our communities and with the health of our society, and ultimately the health of our planet. And that's how we need to think about health in the future, I believe. And our starting point, of course, is relationships. Talking together, working together, creating together. Thank you very much.